Lightweight, feature-rich, new-pack ventilators perform on the go, from the outside world to ambulances, ERs, hallways, and MRI suites. They're ready whenever you are. This video covers the following topics for the operation of the Parapac Plus 310. Patient ventilation, quick setup. The following steps show how to quickly set up the Parapac Plus to ventilate a patient. If needed, turn on the gas supply. Check that the visual alarm for the gas supply has changed from red to white. Connect the hose to the side of the ventilator. Turn the function switch to position 1. Check that the alarm indicators flash in sequence to indicate correct function. Next, set the ventilation parameters to suit the patient. Briefly cover the connection port of the patient valve. Check that the peak inflation pressure reading on the manometer is appropriate for the patient. That the pneumatic audible alarm sounds. And the high inflation pressure indicator shows red. Connect a face mask or endotracheal tube to the patient valve. Check chest movement and inflation pressure manometer to ensure correct ventilation. Check that the green cycle indicator light flashes when inflation pressure rises above 10 centimeters of water. Once the ventilator is operating, make appropriate adjustments based on clinical observation, expired carbon dioxide, and pulse oximetry. The patient's response to ventilation, indicated by chest movements and oxygen saturation, as well as the inflation pressure indicated by the manometer, should be kept under constant observation. This will allow changes in lung ventilation due to possible alterations in airway resistance and lung compliance to be detected and corrected by adjustment of the ventilator before the patient is put at risk. If the tidal volume setting is increased at any time during ventilation, make adjustments to other relevant controls on the ventilator based upon clinical observation. When ventilating with a mask, the peak inflation pressure should ideally be kept below 20 centimeters of water to minimize the risk of stomach inflation. Watch for the following conditions and make adjustments accordingly. If the pressure jumps excessively at the commencement of inspiration, an airway obstruction is indicated, and this must be rectified. If the airway is clear, the flow rate may be too high, and decreasing the tidal volume setting should reduce it. Excessive pressure at the end of inspiration may be the result of a tidal volume setting that's too high. This can be corrected by either reducing the volume setting or increasing the frequency setting. When ventilating with an ET tube, a sudden increase in patient airway pressure may indicate tube kinking or other obstructions. If the inflation pressure is too low or the low pressure alarm sounds, check hose or connection leaks, that the ventilation parameters are correct, and that the patient valve is functioning properly.